if you were listening before our sponsors joined, the passion, the absolute pure passion that Tyson was exuding right there for what he's doing with this Renegade Run. First of all, we haven't said how or where the website is. Where is the website for this as we get back into it? The Renegade.
The website is www.type1renegaderun.com. Now that's the one is the word. So TYPEONE, renegaderun.com. There you can find all the information about who we donate to, how to register for the virtual run, past years pictures, how to donate. You know, we have some people that are doing campaigns. And like I said, not only do we donate to Dr. Faustman, who Dr. Joe, you were talking, maybe we can get her on the show sometime. But we also
that'd be great.
Tell us about our campaign, our Type 1 Cares campaign for folks that can't afford either care or supplies, or sometimes actually we actually do send kids to Type 1 camps. Unfortunately, that went out the window this year, but we do send kids to Type 1 camps that are local. The Jocelyn, the Barton Center for girls, and there's a Jocelyn camp for boys. Clara Barton, yeah.
You know, it's so great, and I love the stories that you were telling about when people were able to do this, not virtually, but in reality, and the sense of community and the sense of destigmatization for a kid to be around all these other people. But it's not just the people with the diabetes, it's their families, it's their friends, it's all these other people that are affected by that.
Yeah. You know, it's similar, not to bring up COVID again, but think about if someone gets diagnosed with COVID, comes out with COVID, and they're an immediate contact. It spreads from there, right? It's the same idea. So like, I'm diabetic, my daughter's diabetic. There's so many people involved. Like all my clients, I include them in, so they don't see me randomly looking at what looks to be a pager. And you've got the school teachers, the school nurse for my daughter. You've got just your immediate family. You've got friends. It spreads. It's just like your contact tracing for COVID. A diabetic it affects more than just the patient. It's everyone that comes in contact with them.
Yeah.
And the concern is when, especially teenagers, that they don't include the people that they are in contact with. They kind of hibernate. And what we're trying to do to the people for the kids that are involved with the run, we're trying to get them to be confident in their disease, saying it's not bad. Like, you can tell people that you have diabetes. It's not. You have to educate them, and it's not contagious. You know what I mean? So that's one of the things we pride ourselves on. It's confidence in that child to not only manage their disease, but to say, hey, yeah, here's my insulin pump. Yep, I'm diabetic.
Right.
That's what it comes down to.
Have you found teenagers who deny that they have it? Because I certainly have seen this in my world in psychiatry, some kids who just won't take their insulin.
I think there's definitely the teenage years where you can experience diabetic burnout. And I'm not saying that it wouldn't happen at a younger age or an older age. You have that. But I think with teenagers, there's so many hormones. You got the diabetes burnout, you got hormones, you've got people the kids that just want to be normal. So it really depends on how they've experienced it. You've got kids, some kids are diagnosed at 13, 14. And at that point, it's like, now I'm doing whatever I can to be normal. So they want to deny it so they can just pretend it's not really there. Just because it means they're different doesn't mean they're denying the fact that, they need the insulin. They're denying the fact that they need to be different.
Right.
And that comes down to feeling confident.
And for you, Tyson, I mean, you've been managing this, you say, since college, since your early 20s. What has been one of the greatest challenges for you?
As a patient or as a caregiver? Because
as you see, as a psychiatrist, I get to leave it open-ended, so you get to answer any way you want.
Good night.
Who was that?
That was my son going to bed.
Hello, son.
So as a patient, I'd say the greatest challenge has been concerned about insurance. Luckily, I've been working my butt off at the Y for many years, so I'm covered. Without insurance, I don't know where we'd be. As a caregiver, the whole disease stinks for me. When Elise was diagnosed 3 years ago, we just celebrated 3 years, actually 2 days ago. I had never hated the disease until then. And I mentioned that when I was on the show with you. It's still very emotional.
Yep.
She's the reason that we want a cure now. I'm not worried about me. I'm worried about her. I don't want her growing up and having to worry about that. Having to worry about insurance, having to worry about getting too much and not enough insulin. So that's been my greatest challenge, is dealing with her having it. So that's my new motivation.
She's how old now?
So she's 8. She's 8.5.
So the Renegade Run coincides with your daughter? It's because this is the 9th anniversary.
Yeah. Well, so she was diagnosed when she was 5. And up into that point, the type 1 run was, the Renegade Run was about just the disease. Like, Paul and I got together because we wanted to cure it for me. And then in 2017, it was, I think, 10 days before the race that year. So the race was on Friday the 13th. Imagine that. Like, geez, Friday the 13th is all that bad luck stuff. That's when we were in the hospital for the weekend. She was diagnosed right before the race. So that has been my driver since then. Not to say we weren't driven before, but now that's what it's all about.
Yeah.
So it all changed. You had this great ambition, this great run, this great purpose, and then it got greater.
Mm.
Yeah, exactly. But just to reiterate the answer to your question, Dr. Joe, it's a different disease when you're a caregiver. And it's different than you are when you are just the patient, because as a patient, you just try to stay alive. You do whatever you can to stay alive. But as a caregiver, it's like you do whatever you can to make sure that, your child is well and that you see an end to it, because it's debilitating.
So, that opens a whole nother area. Unfortunately, we only have a couple of minutes, but if we know that stress increases cortisol, which can make your blood sugar go up, how do you manage this? The stress of being a caregiver, but also having type 1 diabetes. This gets to our 2 questions. So the first thing with the IM, small changes have big effects. And I'm wondering whether you could give some advice to our listeners, because there's a lot of stress out there.
Right.
What small change can they make so that they can survive this?
Yeah. Well, it might be big for some people, but I think a small change that people have to really think about their own health first. When you go on an airplane, which was so long ago for a lot of people, they tell you to put your mask on first. So to care for someone else, you have to be able to take care of yourself first. And it may seem big, but it's really small. Like, and I can tell you, dealing with Elise, like sometimes I care for her more than myself as far as the numbers are concerned. But I would say that's a small step. Is just think, and it's before they even execute it, just think about it first. Like, think about you first. Like, you can't be well for anybody else. You can't make progress until you start to think from your side. Like, I have to do this, because you can't perform a task if you're not mentally there.
Yeah. And it's not being selfish, folks.
Right.
It's just the opposite. You take care of yourself so you can care for others.
Yep.
Which leads to the second truth of the IM. Because everyone's interconnected and everyone's interested in what you think or feel about them, which has an effect on their biological domain. You control no one, you influence everyone. You get to choose the kind of influence you want to be. Tyson Sunnerberg, what kind of influence do you want to be?
I have always strived to stay positive about everything and surrounding myself with people that have the same thoughts. I know that being negative, it weighs on you, and it's much more energy to be negative than it is to be positive. We've got one life to live, and if you continue to take steps backwards, it's going to be a much bigger leap forward to make that step. And I've never been anyone that's been afraid to try things out, because what's the worst case? Like, back in high school, when you're trying to get a date, what's you gonna do? Say no? Big deal. Big deal. You have to try to make that positive approach. It does you no good to just assume the worst. You have to hope for the best.
Well, I think it's an incredible ending message. Renegade Run, folks, please go check it out. Let's help these folks with type 1 diabetes.
New shirts,
Tyson,
man.
thank you so much for coming here. Folks, we'll see you next week on the Dr. Joe Show.